why are you violent? Why have you filed a lawsuit? What makes this case so important? Why is it such a landmark case? What does it mean? Why is this happening?
But when this happened, I think that there was a feeling along around May is when this started. They're never going to stop.
Yeah, so gain-of-function studies, also probably definitely maybe herd immunity, because that's obviously a huge talking point that everyone's debating about, which is pretty ridiculous considering that it's always been just a fact of nature.
Right.
And now it's somehow like some kind of, plan for mass murder apparently is...
Well, the bottom line is everything we think we know and have known for generations, hundreds of years about health and everything else, we just thrown out the window. Nothing makes any sense anymore. Yeah. I mean, it's like whatever would make sense, they do the opposite. That's sort of the way things are going.
Exactly. And of course, you and I know the reasons. Things like shock doctrine and all these psychological warfare tactics that are the main drivers for why they want to. We've known that since, obviously okay, so let's see what else. Herd immunity, gain-of-function studies, definitely. Because these are like, and obviously, the big picture, like why, obviously in your book, the main things about this is why it happened, where we go from here. Because honestly, that's probably the most important things and I'm sure not a whole lot of people, get that deep into. I don't know how much you're willing to actually, disclose. Considering.
Oh, I'll disclose. I'll disclose as much as we can disclose by 4:30. That's so. And I don't want to withhold things. I've been putting a lot of stuff out on YouTube. Okay. The only limitation I have on YouTube is what they'll take down. Yeah. So exactly. if I don't talk about something, it's not because I'm saying, oh, I'm not going to tell you buy my book. It's because I know I'm pretty good about what they're going to take down, and I'm just trying to avoid that because if the channel goes away, that doesn't help anybody. So
we don't want.
I've been putting a lot of the stuff like that in my newsletter because they can't censor the newsletter that I'm sending out through our own server. They don't have that ability. Yeah. So.
Okay, so yeah, that will probably come up, obviously, as well as, the suppression of so many credible individuals in science itself. Hey, so welcome everybody. I've got Dr. Popper here with me, and I've been wanting to get her on for a long while to cover some of the most important information around this COVID debacle, as well as congratulations on your new book release. I know that's a huge project, and I know you've been working nonstop, day and night, as you always are, putting out constant relevant information, literally almost every single day, just as I do. So I know exactly how taxing that can be, and so congratulations on that. For my audience, I'll give you a quick introduction. Dr. Popper is someone that I've personally been following for many years due to nutritional and dietary information and sorting through lots of different types of disinformation and corporate propaganda that has been going around and nefarious things that have been going on in the field of science, nutritional science, what we call the medical mill in general. To summarize, Dr. Popper is someone I very much respect for her tenacity and her authenticity. She's one of the most authentic people that is out there today, and she's a colleague of just about the most credible doctors and physicians, and has got a great network over there at Wellness Forum Health. So I highly recommend. I will include all the relevant links to her book that we're going to be discussing, all of her relevant courses and classes, things that she's got going on, resources to help you guys through this COVID debacle, things like homeschooling, how to get your kids out of the public schooling system and into a good homeschooling program. and all sorts of other resources at makeamericans.free.com. Tons of really good resources, so you guys can check those in the description links below. So without further ado, Dr. Popper, let's hear about the latest updates and some of the most important information you've got going on with your lawsuit.
All right. So first of all, I don't want to do this. I mean, I've kind of been, if in a perfect world, I would be doing other things than this. I had a different year planned, like everybody did, right? Right. And I could kind of feel everybody who's thinking about it arriving at this conclusion. So, like, what are we going to do? And so what happened for several months is what happens when people are upset, angry, terrified. Everybody just starts doing anything, all right? And I get that. We're going to file lawsuits. Well, there's been 5,000 of them. And we're going to have protests, and there's been a lot of them. And we're going to write to people, and we're going to send emails, and we're going to go visit the city council. And I think all that stuff is good. But sometimes you can just wear yourself out with some of this, And so I started looking at this and thinking, okay, what are the really important issues that we've got to pay attention to here? Okay. One of them is we've got to get our freedom back. All right. We have to get our freedom back. And they're not going to stop this. That's apparent. It's getting worse instead of better. The fewer deaths there are, the crazier they're getting, right? So how do we...
We're in an emergency, though, right? That's the argument is it's
right. It's an emergency. Yeah. So the lawsuits, how we got into this lawsuit thing, because the first thing was makeamericansfreeagain.com, because I thought this homeschooling thing that you were talking about was a big issue. Millions of parents saying, I'm not sending my child to school with a mask, to be afraid of people, to be afraid of children, to think, can you imagine an 8-year-old thinking, oh my gosh, a virus can come out of the sky and kill me and my family? I mean, we have children who are terrified as a result of this, right? Mm-hmm. So we did that, and we've helped. I mean, you would not believe how many tens of thousands of people we have helped pull their children out of school, find the right program. And by the way, I just have to add this in. A lot of parents are finding out that their kids weren't learning a whole lot in school, and it was probably a good idea that they pulled them out. So I don't see a lot of these kids going back, actually, when school is normal again. But then the second thing is this freedom issue. And I was looking at all of these lawsuits that are being filed. A lot of them lost, and you can learn from that. Okay, that's what happens with lawsuits, is you go through a learning process when you're getting into new territory. And here's what was going on every time. Person goes in, files a lawsuit or a group, and they say, our rights are being violated. This is a true story. The other side shows up, the government, and says, it's an emergency. We have to do this. And the judge goes, oh, well, you do have a point. Now, there were a few exceptions, but in general, that's what was going on. And 5,000 times it was going on. And so I was speaking with a lawyer in Florida. We were talking about the right kind of lawsuit. And the right kind of lawsuit, we thought, was to challenge the emergency. And it just so happened that about the time that we were having these conversations, this guy was really generous with his time. He doesn't practice anymore, but he was really generous with his time to spend with me. I got a phone call from a guy by the name of Jason Hedges here in Ohio, who had started a group and had found a lawyer who was thinking this exact same way. He had already arrived at that same conclusion that what we had to do is challenge the emergency. So we all got together, because we all have an interest in this, and said, many hands make light work. Let's all work together. In Ohio, I think we have a really big cohesive group of people. And so we filed the lawsuit August 31st. And the thing that makes this different is, first of all, we filed it in federal court, because these little emperors and empresses that we used to call governors, they have a lot of power over the courts in their area. Mm-hmm. And so a lot of the state courts and local courts are just a bad place to be. You have to pay attention, to jurisdiction a little bit. So we filed in federal court, but what we basically said is, we think there is no emergency. We think that they know it, and they're committing fraud. That's a pretty serious allegation.
Those are claims. Those are huge claims. And I know that you have the solid case.
Oh, yeah. Yeah.
You said that Tom Rentz's case was, 700 pages of...
Yes. It was the complaint part of it was 59 pages with 288 references, and then 627 pages of supporting evidence from experts. We had medical doctors and psychiatrists and people who were experts, not just in the there is no emergency and the testing issues and that sort of thing, but the collateral damage that's being done as a result of all of these actions that are completely unwarranted.
And so that's the big issue here, though, is the overall harm, as David Katz always emphasizes so strongly, is the overall amount of harm reduction that we're trying to accomplish with public health, which is the whole objective. And it appears that the basis for this lawsuit is that the overall amount of harm being done, the methods the course that we're taking, the actions that we're going, the direction that we're heading, is leading to overall maximum public harm, as opposed to minimal public harm.
Right. And so what's happened is the cure is worse than the disease. To the extent that, flu is always a problem for certain vulnerable people and all that kind of thing, that's been going on for a long, long time. But the cure that we've come up with is completely worse than the disease. And it does not allow people to do what we let them do in every other aspect of their lives, which is to determine the risk that they think is appropriate to them. And Tom uses a great example. He says, skydiving is really dangerous, all things considered. But we don't keep people from doing it. We just make them sign a paper saying that they understand the risk, right? Now, I don't want to do it, but I'm not saying, listen, because I don't want to do it, we got to pass some laws making sure nobody does it. We let people do downhill skiing. Okay, that's dangerous. I mean, didn't Sonny Bono die when he was skiing? So what do we close the slopes, right? But we let adults choose. So the bottom line is that in trying to keep anybody from getting the flu, the collateral damage is killing more people. And there are now, this is kind of near and dear to my heart, but there are more deaths from the collateral damage than the number of people worldwide that Hitler slaughtered during World War II. He did it in concentration camps. We're doing it with overdoses and suicides and people, just older people dying alone, despair. I get an email every day from somebody who says, my mother's 87 years old, just stopped eating. They just lost all hope. I saw one video that made me cry. This guy was trying to see his mother or grandmother or whatever, and she's on the other side of the glass and she can't understand, like, why won't you open the door? It's almost more torturous to have the visit than if you just stayed away. You can't win, right?
It's like a zoo. It's literally like a zoo exhibit that is going on in these nursing homes. And this is the huge disconnect that most of what we call the Karens, or the people who are they're caring, all right. They're caring enough about other people's well-being while somehow seemingly entirely detached from other people's real world experiences other than their own. So they're able to stay at home, and shelter in place for years on end, because they're perfectly well set. Who knows? They work online. Their businesses are fine. They've got welfare, whatever. They're fine. They don't have to worry about the stories from other people. And the problem is they're simply not hearing the experiences of what is actually going on in these nursing homes, and with these people from isolation, and even so much that you've covered about even the college, students and their isolation centers that they were having, cross contaminations and all of this. But that was a huge aspect that I did want to bring up, that I heard from Tom Renz in his interview with Peggy Hall. Specifically, some of the most important stuff about the nursing home information is that he said that there was literally one aspect that they're doing, which is the mandatory testing, that literally legally qualifies as human trafficking. Because apparently he's uncovered about the evidence that they are getting paid for each PCR test that they are administering. So they're getting is that correct? They're getting paid for each PCR test that they're. So this is a huge aspect of the whole thing is everyone's getting paid. That's why I call it I mean, I don't want this to get banned or anything for saying this, but that's why I call it a scamdemic.
Providing cover for government corruption. Under emergency laws during the current coronavirus pandemic, the government doesn't have to put contracts out to tender.
Tenders are not legally required when you're in an emergency situation like this.
Which means they can give contracts away to inexperienced private companies or to friends. Take PPE contracts, for example. During the height of the pandemic, the government gave £108 million to manufacture PPE to a chocolate wholesaler. This company had no experience whatsoever in making personal protective equipment. Then you have another PPE contract worth £108 million, which the government handed to a pest control company. This company had only 16 members of staff and was worth just £19,000. The government is now facing a lawsuit over this misuse of public funds.
Corruption related to PPE, life-saving, for me, it's actually a murder.
Another contract that has raised eyebrows is with Public First, a company which is run by a former aide to Michael Gove and associate to Dominic Cummings, Boris Johnson's chief political advisor. They were given £840,000 of taxpayers' money for researching public opinion. Cabinet Minister spokesperson Helen Hayes said the contract is justified as part of the coronavirus response, but appears to be related to Brexit. Public First is owned by the married couple James Frayne and Rachel Wolfe. And when Michael Gove was Education Secretary, he brought Frayne in as his Director of Communications. Gove's department then awarded Wolfe a £500,000 contract to promote free schools. Schools which have since been branded by critics a waste of taxpayers' money. Unsurprisingly, this didn't go to tender either. Public First has also been given a contract without tender to work with Ofqual, determining the strategy for A-level results. And then there's Topping Grin, the PR firm which was behind the controversial idea to change the CCHQ Twitter page to a false fact-checking page during the election. They even created a website set up as Labour's manifesto to sow confusion. They have been handed a £3 million government contract to work on COVID-19 messaging. And if any of their previous work is anything to go by, we can expect more lies and confusion. These aren't the only questionable contracts which have been handed out during the pandemic. Overall, £830 million has been handed out to over 12 private companies, and out of all of them, no PPE has materialised. Dido Harding, the Tory MP in charge of the failed NHS track and trace app and the TalkTalk hacking scandal, was recently appointed the new boss of the agency replacing Public Health England, despite having no experience whatsoever. She was once a consultant for McKinsey, a company which was given £560,000 just for deciding the vision, purpose and narrative of the new Public Health Authority. Then you have Serco, the company best known for running inhumane detention centres. They've been handed a test and trace contract worth £45 million, despite being fined £1 million on a government contract this year. They've already had to apologise for breaching data protection rules on the app. The government has had plenty of opportunities to award contracts to genuine suppliers. There have been countless stories of suppliers reaching out to offer help for PPE, but they've almost always been met with silence.
Channel 4 News has spoken to a number of distributors and manufacturers who have made offers to the government, repeated offers, only to hear nothing back.
That tried to give PPE to the NHS, spoke to Matt Hancock's office, referred to the Cabinet office, then referred somewhere else, disappeared into a black hole. Eventually, the company sold the stuff to America. Shameful.
So now you can see, now we have so many stock.
And here are boxes containing 100,000 PPE protective suits shipped from Italy to Shanghai and waiting to be sent here. Except the UK has not yet taken up this offer.
Boris Johnson has recently promised an independent inquiry into the handling of coronavirus. We must ensure that this lack of transparency, which is so crucial to democracy, is looked at closely. Flexibility under emergency coronavirus powers are not an excuse for the misuse of public funds. The government must be held accountable.
Is literally, it's a scam on proportions that we've never seen. The world has never seen.
Right.
To be quite honest and upfront, like this is a false flag operation. That's what this is. I mean, I'm sure that's probably why your book is titled COVID Operation. But so that's the basis for why it's everyone's getting paid off of this pandemic.
Well, and it's been going on forever. The problem with medicine is perverse incentives. All right, we get paid, medicine is paid based on how much stuff you do, not how effective you are. All right, nothing else works that way. In other words, if I pay my car repair place to change the oil or to fix the brake pads so that the brakes don't squeak, well, if you pick up the car and the brakes still squeak, you take it back and say, you have to fix this or I'm going to reverse the charge on my credit card, right? It doesn't work that way in medicine. You just keep doing stuff and billing and billing and billing. So one of the most perverse things that's going on right now is the hospitalizations. You know, they're making you get a test. Let's back up and just say, we're using a bad test that was never designed to be used to diagnose anything, to gin up cases, the number of cases, and most of these are in asymptomatic people, that determines the lockdowns and the restrictions and all that sort of thing. So never in the history of mankind have we ever said, if you were exposed to the flu, if there are enough of you that were exposed to the flu, we're going to shut down something, all right? But that's being used. Then you have to keep the cases coming. So everybody has to get tested before they can go in the hospital. So let's say here in Ohio, because the reimbursement rate varies, but here in Ohio, if you are getting your knee replaced, for example, you have to get tested. If you're positive, even if you have no symptoms of flu and you're in the hospital in Ohio, positive but getting a knee replacement, you're now a hospitalized COVID patient, and the state gets $180,000. So now they'll test you, and I don't know if it's like this in Ohio, but I just watched a very disturbing video from an area in California where they acknowledge that they'll test the same person again and again and again while they're quarantined. And every time they test positive, it counts as another case. So one person can become 15. Okay. Yeah. You know, that's unethical. Number one, you're getting paid to do all those tests. It's unethical. And then the governor or the commissioner or whoever it is gets in front of the camera and says, oh my gosh, you've got this big spike in cases. So now we're going to have to shut down the restaurants and shut down the bars. And, you know, it's unbelievable. I've never seen anything like this in my life. I've seen it in medicine for 25 years, but I've never seen it in this full blown, you just can't even believe it's going on kind of thing.
So a lot of the people actually, you know, covering the raw data, they're calling it a case-demic. Case-demic is where you just simply test everyone over and over and over again, sometimes the same people over and over and over again. And so the more you test these people, the more obviously positive PCR tests you're going to get. And of course, amongst those countless cases that are rising and shooting through the roof, simultaneously, the levels of actual, you know, severe cases, which are real, I mean, they shouldn't even be called severe cases. Those are the real cases, are the ones where people present, you know, actual illness. That's what has traditionally always been classified as a case.
Right, but even then, you differentiated between people who had the flu. I mean, you can get the flu. And it's, I mean, you stay home for a couple of days, or maybe you stay home for a week, depending on how severe it is. I've had, in the last, I think it's 25 years, I've had the flu 3 times. And you know, 2 days later, I feel okay. We're done with that now. We go on, right? There's no reason to count me as a case or to have any decision based on the fact that I had the flu. We had 2 people here at the office they weren't at the same time sick, but at the beginning of the year, they were each out for 2 days. So we were all exposed to it. I mean, we're all working together in the same office. So, but we never thought, this is back in January, we never thought, oh my gosh, an employee has the flu. Lock the doors. Don't let anybody in. We're done. We're going home. I mean, you know, that's not the way people behave. So what you're really looking at is what are the severe cases? And they've always been in people who were ill already, and a lot in the nursing homes. And I want to say something, because this is just so bizarre. So what they're telling us is we have to lock down, wear masks, stay home, you know, shut down businesses and the whole 9 yards in order to stop the spread. Well, here you are in the nursing homes. They're locked down. They're separated from humanity, testing them all the time. And that's where all the deaths are. It's not working out. I mean, and yet, like we said in the beginning, it's almost like the better it gets, the crazier the rules and all that sort of thing are.
Yeah. So this is Mostly it's I mean, Jeff Nelson, Vet Shores, always calls it, it's a disease of the nursing homes, and it really is. Those are the vulnerable people are, the pretty much the only at-risk population, other than, large comorbidities like diabetes, heart disease, cancer, all of that stuff. But the majority, like Ivor Cummins does a lot of data reviews on his channel, very frequently covering the data specifically to Ireland. And, his data shows that 95% of the Irish deaths were mostly too aged and moribund, meaning they were already so ill before getting COVID that they weren't even admitted to ICU because it was just it was unethical. I mean, they were so moribund, they were so aged and already comorbid that they weren't even permitted to ICU because it was irrelevant. I mean, they were already, and we've had Neil Ferguson come out and say this. Over 2/3 of the deaths would have died within this year anyways. So it's not like they were a lot of these cases were actually going to die, several years off. Most of them were all going to die within this year anyway.
Right. Exactly.
And it shows in that data that, it's a lot of it is largely because the 2019 season was very soft. So obviously it's going to, less deaths in 2019 due to the flu and, things like that. They had a soft year. And so it contributed to a larger spike this year. But, so what we're seeing right now is obviously they keep saying that the deaths are using these predictive models yet again, that the deaths are going to, 20,000 deaths per day is what they're expecting. And the data is not showing that. It hasn't shown that. And it's consistently showing the opposite of that. And like you say, the measures and the control and, the whole societal change continues to get stricter and stricter and stricter. And I mean, it's even the worst is in obviously Victoria, Australia is probably the worst of all. I mean, they've got like less than, I'm not sure, I haven't checked in a little while, but I mean, it was less than 1,000 deaths the last I saw. And, out of a population of millions, of course. So, I mean, that's like the hospital, like a single hospital capacity. It's insanity. It's insanity how, these, especially when you consider, overall public health damage, the overall damage is coming worse from the measures that we're using to protect ourselves from the virus than it is from the actual virus itself, which is why they, what is the name of that declaration they all just signed?
The Great Barrington Declaration.
We've got thousands upon thousands of, and these are the world's top experts, the world's top virologists, epidemiologists, infectious disease experts, and I mean, just thousands all over the world. These aren't, conspiracy theorists and crackpots. I mean, it's not like to say that there isn't legitimate conspiracy. I mean, because when you dig into the evidence and the facts, there has to be legitimate conspiracy going on behind some of the reasons. As you've reported in one of your powerful, I wanted to isolate that segment out and just like blast it everywhere, was one of the emails that you read from one of the governors to, what was it? In that email, they were revealing how they had to, what was it? They had to lie to make up more excuses to continue lockdowns.
Yeah. I think you might be talking about Nashville, Tennessee, where the mayor and or the council or whoever it was that was involved in this, they were having a conversation, and it was basically closing the bars. There was no reason to do it. There's no evidence that there's an outbreak. So how are we going to spin it? I mean, we know that they're doing it. And so, as I said, they're not going to stop. It's not going to get better unless we make it get better. And so that's why we filed this lawsuit. And what we're doing, first of all, we'll be following this case. We're in the procedural part now, which is sort of like watching paint dry, if you're not an attorney. Mm-hmm. But we're in the procedural part, back and forth with some stuff. But we're getting ready to file in a second state very soon. And we're organizing 4 other states right now to get ready to file. So our goal is to find attorneys and help do in these other states what we did here. And I think where we were really effective was having the right lawyer, and they're out there. I mean, they are out there and they understand. Now, we have the right lawyer. We have a lot of people working on this. You need infrastructure because you've got to raise money, and you also have to have people to help out. I mean, I'm willing to work for free to help out, and so you need a lot of people like that because you just can't afford to hire big staffs of people and paying the lawyers enough, right? So we're helping other states to get organized to do the same thing. And one of the nice things about filing in lots of different states is that you're inevitably going to have pieces of this thrown out here and there, but enough of it will survive to get to the United States Supreme Court that we can have some decisions made that are very important. So on the local level, what we want to do is free Ohio, right? But on a bigger level, a macro level, we have to make sure that this can never happen again. So what if the person who replaces Mr. Fauci, I won't call him doctor, Mr. Fauci, what if this person says, oh my gosh, we have more people dying in car accidents this year than we've ever had. So until we get a handle on this, we're pulling all people off the roads. Well, we'd all starve to death because without trucks hauling food, we're not going to have anything to eat sooner or later, right? So that's not a whole lot different than what's going on. And we've got to make sure that we get some very important questions answered, like what is the definition of an emergency? Yes. Who gets to declare it? And for how long without some kind of oversight, and what does that look like? Because what we're finding in every state, now in Ohio, we found out that in Ohio, the law is very clear. You can declare an emergency for 120 days, and then you have to open it up for comment. You have to provide data. You have to get public comment. So our emperor is about, let's see, July 12th is the day he should have started this. So August, September, October, November. We're almost 4 months past when he should have made the information that we're asking for public to everybody in Ohio for comment. So we do have some laws; they're just not following them.
Yeah.
So
that's this is the really important stuff, is because there's documentation from the World Economic Forum is probably the most influential in this whole organizing. The COVID-19 preparation, the response, the plan going forward into the future. And this is the big stuff that we really need to address, because you and I know, and we have the evidence to prove this 100%, is that this is not a one-off thing that is going on here. This is not, you see, most people are, just do everything that you're told. We'll get through it really quick, and we'll get back to our normal lives.
No, that's not the plan.
That is not in the plan. That's not in the plan for. Let me let the dog out real quick.
Oh.
All right, sorry about that. Okay.
That's all right.
So yeah, that is the plan. I mean, these are the big things that we need to address. Is that at any time, anything could be used as a threat to declare emergency, state of emergency. Like this is what. Tyrannical governments and tyrants behind some of these influential players, World Economic Forum, World Health Organization, CDC, NIH, a lot of these things, NIH especially, Fauci's NIAID, these organizations that have funded the gain-of-function research. And this is the huge thing that just blows my mind that we also need to address first and foremost is we need to put an end to gain-of-function virology, because apparently what is coming.
But we did. They just didn't follow the directions, I think that's one of the things that I discovered that was so disturbing. And I wrote about it. One of my business partners, Peter Reagan, wrote about it. Others are writing about it. But what happened was that this gain-of-function, as you bring this up, in case people don't know what it is, it means that you go take a virus and it's the time that you start is not transmissible from animals or bats to humans, and you play around with it until it is. And then the idea behind it sounds pretty good in the beginning until you really realize what the consequences are. That you can determine how fast you can make a vaccine, how fast you can come up with a treatment. Well, I think it was 2012 or 13, the government decided that was a really dangerous thing to do. That there was a chance that something lethal could leak out or whatever, so they put a stop to it. But Fauci authorized the funding to continue. And the University of North Carolina, Chapel Hill, and this Wuhan Virology Lab were collaborating to take a bat coronavirus and make it into a transmissible human-to-human virus, and they were successful doing it. This isn't a conspiracy theory because they published an article in Nature Medicine, a pretty prestigious European journal, and they even hinted, I don't remember the language, but it was like, maybe we shouldn't be doing this, a little bit of squeamishness about it. Mm-hmm. But that's not the only thing that was going on. There was other research like that at the virology lab. Yes. A woman there, and her name escapes me right now, I'll think of it in a minute, but she was called the Bat Lady. And she actually was going to caves and getting bats and isolating viruses, who disappeared when this all started. But we did some research on the Bat Lady, and she was reporting transmissible viruses in medical journals with a research group. I mean, this wasn't like some lone crazy person down in the basement somewhere. This was being done in well-known, world-class labs with governments involved. So we don't know. My co-author and I did quite a bit of research on this when we wrote COVID Operation, and we had to acknowledge at the end that there were some things that it wasn't possible to know definitively, and we don't know if this virus is one of it came from that. But the fact that this was going on tells you that there's something. And by the way, Trump withdrew the funding for it April 28th. It was going on. We were sending money over there after this whole thing had started. The government was still sending money, which just kind of blows your mind, doesn't it?
Exactly. See, that's the thing, is I've been putting out the gain of function stuff ever since I think the first I heard about it was from Robert F. Kennedy's, one of his updates about it. But obviously I don't just trust one, single person's news report. I went dug up all the primary stuff myself. I started doing my own independent stuff, and it's in all the published peer-reviewed studies. Anyone can find this in the peer-reviewed studies. And I mean, I was trying to get like everyone that I could to possibly, give me more information about it, tell me why, why this could possibly be acceptable and okay. So I started messaging Dr. Garth Davis on Instagram and stuff. And we got into big debates. He started calling me, all sorts of names, conspiracy theorist and all this. And I've been trying to get any type of credible person to simply acknowledge gain of function virology. Like people like Garth Davis, they wouldn't even, and I mean, other well-respected cardiologists as well, that are also my personal friends, or were my personal friends before they blocked me, for simply showing the gain of function studies and asking them what they think about it. And nobody wants to touch it. Nobody will touch it. Nobody wants to acknowledge that it exists, let alone read the actual publications about it. And this is the hugest thing, because as long as this is going on, it's like nuclear warfare, only on the microscopic scale. And that's the era that we have just moved into, as Fauci has been saying for over 10 years. He calls it the era of pandemic diseases. And as we know through all the countless interviews with Bill Gates has, with Stephen Colbert, came out and spilled the beans and was like, yeah, we're worried about bioterrorism is our biggest, threat for the future, is a biowarfare agent. And he called it Pandemic 2 is what him and Melinda are expecting. So, and obviously, I mean, with the era of emergent pandemic diseases from factory farming and, all of that stuff, that does legitimately promote all of these, animal pathogens that become pandemic diseases. But the people who are funding those gain of function studies, like Bill Gates and Fauci, they have been predicting this for a while, because obviously it could be a potential huge threat. But I think it's a bigger threat when they're actually creating more pathogenic and more transmissible viruses through chimeric gain of function studies, which it's like creating nuclear weapons in the effort to prevent nuclear. It's on that level of logical thinking. It's like we have to prevent bioterrorism by engaging and enabling the tools for biowarfare to happen, which is through these gain of function virology studies. And of course, the evidence for this being so dangerous is the SARS original outbreak was countless times leaked from the Wuhan laboratories. It was at least 4 times it was leaked, the original SARS. And this is in the peer-reviewed published research. Like, this is not, conspiracy theory. The published journals are publishing that the original SARS was leaked several times from those laboratories. So the original SARS coronavirus was. And now I literally just got this thread on Twitter from a researcher who's been following the origins in the studies since the beginning of it, and she's been publishing counter research to show how there are all these holes in the pangolin research, trying to connect it to a mammalian transmission from the pangolin, then to humans. And she's saying that there was no in her studies, which are she's going to get those published. It was a huge revelation. Basically, a summary. It was pointing that there was no evidence for it coming from any animal at the Wuhan lab. There was, let alone from the Wuhan lab. And so that just in and of itself, right there, it debunked all of those studies that for the basis of the claim that it comes from animal transmission. This one specifically, it's well known that many viruses can come from animal transmission. But this one specifically, just pointing to more evidence that all the science out there, literally the studies, all point to this probably came from a laboratory, whether it was a leak or whatever else may have happened, or whether it was intentionally, I'm not saying that, but the evidence shows that it most likely came from the laboratory, not from, this wet market, as they're saying. So that's just one of the most important things. And we have to keep hammering on that, because as long as that is out there, along with the threat of, any type of emergency can be declared to do basically any type of tyrannical measures. I mean, to suspend the Constitution and, send people to camps. We know they did this back in, after World War II with the Japanese population here in America. They sent them to those internment camps, under the declaration of, it's an emergency. We can't trust these people. So it's like at any time, we can isolate segments of the population. We can call them, harmful, it's setting up our society for a very, dangerous future,
Right.
And that's, of course, from my perspective, that's what they've wanted all along, is an ability to control more of the population, to be able to lock people down whenever they want for any reason, essentially. If they can declare, who gets to declare an emergency? Whose responsibility is that?
Yeah. Well, I guess going back to what we do about it, I think that we all know we're in a mess. Something has to change. So we're using the lawsuit route. We're organizing a lot of grassroots and every state organization building, because I think another aspect of this that's starting to become very apparent is that one of the goals, in addition to separating people, turning people against each other, getting control, that sort of thing, is they want to vaccinate. They want most people to get this vaccine. And this isn't a conspiracy theory. I mean, Bill Gates is on TV every day waving his arms wildly, saying 7 billion people have to get a vaccine in order for us to go back to normal. And who put him in charge, right?
Yeah.
So.
Yeah. I personally, I don't, most people aren't ready to go down this route. I don't know if you are, at least verbally, but I know you do, probably in your forbidden writings and in your forbidden videos section as well. But from what I've seen, as well as James Corbett Corbett Report does amazing documentaries about this as well, is that the overall agenda goes, it's the mandatory vaccination program is merely a means to the ends that they are working for, which is total social control of the population, not just population control. But I mean, Bill Gates, his father was involved. It was one of the founders of the eugenics programs, Planned Parenthood. Bill Gates himself is involved in eugenics programs, which nothing wrong with eugenics. Everyone wants good genetics, of course, but the way they go about that is, suppressing, women's fertility in the third world, like in India, through some of these controlled vaccination programs and things. But ultimately, it's about social control. Like, they're planning on implementing a total dystopian biometric biosecurity state where everything is, all pieces of data are tracked, mostly from this is about, they're trying to push the public into accepting this total control over our own bodies, our own bodily sovereignty, first of all, what we put into our bodies, as well as they're trying to get into, the sanctity of our minds. They want total control of the mind and the body, and they're doing that through this biomedical system, the biometric system, which is, these IDs are obviously have been put out to be, linked to the ID 2020 program or one of these other various, there's numerous programs calling for digital biometric tracking and surveillance, such as, the COVID Pass, which is this digital passport, immunity passport. Bill Gates, Microsoft promoted numerous different types of a digital biometric passport, to control who travels, when, and where, because they could be, contagious and infectious. And so this is so dangerous because it just limits our freedom on the most fundamental basic levels. And it all hinges upon this Internet of Things system that they're putting up. The biometric smart grid relies on a 5G bandwidth program to be able to track and harvest all of this biometric data that they collect from, it will create a digital profile of our health status. It will track our tax status, our tax history, how much fake news we posted on social media, our entire online profile. It goes into, China's already got this, it's called the social credit system. And obviously we know, reporters and journalists who try to get out vital information about certain things, they get put on the blacklist. So they can't travel, they can't earn an income, they can't do things like receive, any type of government benefits, services. For example, like if they start rationing food or things like that, it's like you can't get food rations, you can't get your welfare, checks, you can't get any of these government provided services without obviously having first the vaccination and having all of these, hoops that we have to jump through in order to receive the benefits and the services that the government is going to have, put out for us in order to provide during these eras of emergency, where everything is basically under emergency mandates. So who gets to decide, what personal rights people have during these emergency rules? It's just, so that's the, the direction that I see everything going. And I'm not just, theorizing that. There's tons of data, coming out around that, mostly from the World Economic Forum. It's the central hub for, all of this research about the Great Reset, their new economic plan, all of these things. It all comes from these centralized organizations like the World Economic Forum, Trilateral Commission, Bilderberg Group, these things like that. So that's the direction I see everything going in. Of course, the vaccinations are merely just a means to get to that, but that brings us to the herd immunity issue that I want to also talk about, which is obviously herd immunity is a well-known, phenomenon of nature. As we know, it's centuries of decades-old science, at least. Herd immunity is the way to end all pandemics. So why is herd immunity now being, demonized? Why is everyone making fun of herd immunity on the news and calling us mass murderers for researching herd immunity?
Well, I think the problem is that none of this is based on health. In other words, the fact that the masks are working, why are the cases increasing? And the cases are increasing, but the hospitals aren't full, and it doesn't. Nobody's dying who's under the age of 25, and the schools are closed, and this just has nothing to do with health. That's the bottom line. And I go back to, what are we going to do about it? We're going to have to file lawsuits in every state. We're going to have to then once we start freeing the people, we're going to have to go after the people who did this criminally. That's my plan. We're going to have to go after the businesses that cooperated. One of the happiest days of my life will be when we file lawsuits against American Airlines and United Airlines and some of the people that tortured everybody, which was unwarranted, completely unwarranted. We're going to have messes to clean up after this is over that are just phenomenal. We're going to have to avoid the vaccine mandate. We've got a plan for that. We have a plan for that we haven't disclosed. We've actually come up with something that, and I can't talk about it now, but we've come up with something. It's our attorney's idea, actually, that we think will be an end run around a lot of things that are wrong in medicine. And so stay tuned for developments, but that's coming.
Yeah.
And then we're going to have to clean up we have children, like the people who have resources have pulled their kids out of school and they're homeschooling. The kids in economically disadvantaged areas were functionally illiterate by the end of the summer. And this is an entire generation of children that we're going to lose if we don't do something for them. And we have a plan for that. We're going to have to rescue small business. I mean, these people will not succeed at what they're doing. They're already starting to come undone a little bit. In other words, like all criminals and despots, they lose perspective, they start to make mistakes. They are making mistakes, which is giving us some great opportunities. Yeah. But nonetheless, we're going to be at this probably for the rest of my life. I'll be at it. And what we put forth in the book, and I think it's important as we start to wrap this up to give people something to look forward to that's optimistic, okay? Because it can sure be doom and gloom. I mean, you sit around, you look at, oh my gosh, every place you turn, there's something horrible going on. So here's what I think, and this about how it happened and where we're going, all right? So in order for this to happen, you had to have four things, in my opinion, going on. You had to have an overreaching government that people allowed to become overreaching, okay? Needs to be reined in. Mm-hmm. You had to have an education system that was dumbing down the population so that you would have enough people who bought the story, all right? You had to have a medical system that was so corrupt and so incompetent that you could be guaranteed they would buy a story that makes no sense and get on board, okay? And we have a lot of, like you said, there are tens of thousands of doctors and health professionals and scientists who signed that great Barrington Declaration, reputable people. Yeah. But there are millions of doctors and nurses who bought into this silly story, right? Then you had to have a media that would dutifully report it. So here's what I think is going on. I think that the Great Reset is happening. It's just not their Great Reset, right? So what we're seeing is the collapsing of systems that had to collapse. We see, and we wrote about this in the book. The government needed to be reined in, and people are starting to talk about that now. Not the sheep. I'm not talking about them. I'm talking about thinking people are saying, you know what? We got to have this, like you were talking about. We got to figure out who can declare an emergency. We have all these parents who pulled their kids out of school. And if you withdraw enough children from public education will finally get back to asking parents at the local level, what do we have to do to get your kids back in school? And maybe there's nothing they can do. And we go back to parents taking responsibility for educating their kids. Our taxes will go down. That would be good. And we just get rid of this idea of teaching to the curve and kids falling further behind the rest of the world every year in the United States, right? So that's collapsing. The medical system is collapsing. And here's some really good news. I'm going to give you some very good news. I've been talking for 25 years about too much medicine, people hanging out with doctors until they find something wrong, right? Well, visits to doctors are down by about 60%. Childhood vaccination down by about 60%, all right? So, and if you don't put your kids in school, you don't have to worry so much about those mandatory vaccines anymore, right? So that's all being reset. The medical system is kind of collapsing and it will be rebuilt in a different way. And so I feel that after we clean up the mess, after we help restore small businesses and we rescue the economically disadvantaged kids and we get, it's like cleaning up after World War II. It's exactly like that. In about 10 or 15 years, we're going to have another conversation like this. And we're going to say, you know what? That was one miserable couple years we spent. But look where we ended up. And maybe the only thing that could have done it was that, because I'm 64 years old. As long as I've been an adult who was aware of what's going on, like when I was 21, I was a nitwit, you know, but when I started to become aware of like what government is and all that, you know, really participatory citizenship. We've been talking about education reform. I haven't seen any education reform. You haven't seen any education reform. Now we're getting education reform, right? I've been talking for 25 years about the excesses of the medical system. Okay, we changed it in our own little way by helping members here, but the system wasn't changing. It was getting worse every year. We just got finished with the opiate. Well, we aren't finished with it, but the opiate epidemic, right? So maybe nothing else would have made this different. And I talk to people every day now who are saying, I turned off my television in April and I haven't turned it on. Now, I stopped watching mainstream news and all that kind of stuff, but because I was writing this book, my co-author and I were writing this book, and we were getting ready for this lawsuit, and we were launching Make America Americans Free Again.com. I didn't turn on the TV and even watch, reliable news sources for a while, and I don't miss it. And I'll tell you something else. I've been doing some videos on the fractured relationships that we're all experiencing, which I think everybody's very upset about.
Yes.
And I'm not happy about it, but I look at these relationships, and I've lost some people too.
Yeah.
And the bottom line is they were so fragile that the relationships could not tolerate having a difference of opinion.
Yep.
And isn't this a big deterioration? Because I'll point out 2 times in history that we all know about when people who had, in our country, had serious differences of opinion and they managed to work together and get something done. And the first one was Ronald Reagan and Tip O'Neill. Now, you can't find 2 politicians who are further apart from each other. But if you read Tip O'Neill's book, it's out of print, but you can still get copies. All Politics is Local. They actually got along pretty well. And the definition of getting something or success was you got something done, right? And you recognize that you have to talk to people who you don't agree with in a civil way. You can scream and holler and then have a beer, right? But you stay connected. And then the other one is Newt Gingrich and Bill Clinton. I mean, these are 2 people who are on the opposite. They signed welfare reform. They got some things done, right? And so we have degenerated over the last few years to the place where a relationship is based on uniformity of thought, or it can't exist. And to the extent that that's a pretty fragile relationship, I'm at an age right now where I don't want to spend time with people like that. I'm looking for much more solid connections. And so the interesting thing I observe about my own situation right now, and I think this is something to give people something to look forward to also, I have some people I've known for less than 6 months who I have a stronger connection with than people I've known for 15 years. And those relationships, even though a lot of us not in the same city, they will persevere. They are not going to go away. And these are people who you actually could sit 15 people around a table and find things to disagree about without screaming and hollering, throwing your napkin on the table and walking out and saying, well, that's the way you're going to be, So that's a great reset. I mean, we're all having a little great reset in your own life in a way, and not necessarily all negative. I mean, I could live without not going anywhere, which is kind of what I'm doing now. I'm working all the time anyway, but we're all getting a little bit of a reset. And I think that, like I said, we could possibly in a few years say miserable, but worth suffering through.
Yeah, exactly. I mean, everyone has gone through some sort of shift, and of course, that's what most people need is a lifestyle change on multiple levels. So, of course, that was definitely needed, as we all know, and that's what you specialize in at Wellness Forum Health. That's also what I specialize in as well. In fact, I would love to. I haven't had the funds yet, but I would love to take some of your courses on. Research methodology and a lot of those things. I always share a lot of that stuff with my audience and things because that's a big series that I've been doing recently for the past couple weeks on my channel, as well as for long before that, is critical thinking, courses. So that's the most important thing that you're referring to here is, how is the biggest thing is how to disagree, appropriately, how to go about. It's a formula for learning. Most people don't know the proper formulas for thinking accurately.
Well, one thing we can all think about is, and I think these are the lessons we take away, and this is what public health should be focusing on. Mm-hmm. If you are outside of a nursing home right now, you don't live in one, your number one goal is don't end up there.
Exactly.
And it's not, and the reason is that's where the deaths happened.
Yes.
And the reason why is because how do you get there? Nobody aspires to it. You get there by default because you're weak and frail and sick. All right. So that's fixable. I'm 64 years old, and unless something cataclysmic outside my control happens, I'm not going to live there. You're not going to live there. Right. So that's the first thing. And I think we have to talk about things that empower people. This is something that you can do that will make a difference in your life, and you can help other people do it too. And then get involved in helping us through the reconstruction of the world in a positive way. Let's make our own reset and eradicate theirs.
Yes.
So
Yes.
So on that note, let's end on a happy note. After we're talking about all this disaster and stuff to be worried about and that kind of thing, okay?
It's like all cycles in nature go, is everything in nature goes through cycles of chaos in order to reform into a higher structure of order. That's just how the cycles of physics and nature have always worked. And of course, that is what this is all about. And it's the choice is ours. As
Right.
we either choose to make the positive, healthy lifestyle changes for ourselves and for our families, so that we don't place a burden on our family and our loved ones, so that we don't end up in nursing and care homes, where we don't outsource our quality of life to anyone else.
Right.
To a politician, to a president. None of these people can take control of our lives in the way that we can do it for ourselves. And that's what this is all about, is being able to, it's about self-sovereignty, health sovereignty, and all of these things, maintaining the individual freedom and the individual rights, the right to choose, the choice of risk, the choice to, take whatever procedures that we want to take, depending on the risks, based on, however, it depends on us. And that's what all these experts for the Great Barrington Declaration are calling for, is turn to a selected, targeted approach that empowers the individual and doesn't place these blanket burdens, a blanket policy over the entire population. And so that way the individual has the highest quality of life possible. It's not just about maintaining, saving lives. It's about saving life itself.
Right. And that's what we're going to do. And on that note, thank you for having me. I appreciate it.
Yeah, thanks so much, Pam. I definitely appreciate it. And hopefully I can have you on again about some other topics that are more positive.
Would love to. Thank you. Bye-bye.
Thanks. Bye. My name is Cullen Smith. This is Lifting the Veil. You can find all of my full books, presentations, videos, films, articles, posts at patreon.com/liftingtheveil. And there is also a ton of exclusive content, and I will leave the cited reference links in the description down below. So you can check that out for all of my full content, and I will see you guys in the next video. I rely solely on word of mouth, and the recommended algorithms are not recommending any of my videos or films anymore. My channel has literally been completely restricted, so I rely on your help by sharing my work around if you appreciate it, and leave me your comments. I definitely want to know what you have to share and what you have to think about all of this stuff, and I will see you in the next video.